This video is about how the game changers went full Tropic Thunder, and this is part 2. I'm going to show you how their medical doctors are terribly confused about heart disease. They just blame it on you eat a steak or have some butter and it's going to just trash your coronary, cerebral arteries, peripheral arteries, and you'll see that how they conceptualize atherosclerosis is essentially another fiction story. So it's kind of fitting since James Cameron is a fiction guy, right? He did, in my first video I talked about, I said Pandora, I meant Avatar. So, you know, the big blue people, that's how you want to look at the game changers. So this is the anatomy of an artery wall. And one thing that's missing here, in case anyone gets really picky, would be there's connective tissue here, and there's something called an internal elastic membrane here. So it goes all the way around. And so from the internal elastic membrane, the connective tissue, and the endothelial cells, that's called the intima, the tunica intima. And the media, number 3, is where you have smooth muscles, largely, and then the tunica adventitia, number 4, is where you have more connective tissue to give stability and order to the artery. So this image is in my new book, The DeFlame Diet to Stop Your Joints, Muscles, and Bones from Rotting. And the reason why is because it's important to understand, and I did a video on this back in 2018, demonstrating how osteoarthritis is essentially heart disease of our joints, and atherosclerotic heart disease, conversely, is basically osteoarthritis of our blood vessels. So if you look at it like that, understanding vascular disease is a whole lot easier. So getting back to the image, so this is number 1, this is called the lumen. This is where blood flows. And so in a previous radicalized vegan movie called What the Health, they showed that cholesterol builds up on top of the endothelial cell layer. This has been known to be false for decades, which demonstrates that the information presented in What the Health is completely incorrect, and the medical doctors should have corrected it as opposed to perpetuating it. Now, in the game changers, they showed a little bit differently. They show somehow that there is this buildup that occurs of lipid within the endothelial layer from up top and down below. I mean, it's an artist's effort to show it, but they should have showed it accurately. Now, how should they have showed it accurately? They should have showed it like I put in my book. You can see right here how it actually, this is atherosclerosis, and I don't even have all the players in there, but it shows you what happens. The buildup of lipid that people talk about, which is true, but it's built up, though, largely within immune cells called macrophages that engulf oxidized LDL cholesterol. So the big players in atherosclerosis are going to be hyperglycemia, so too much sugar, flour, refined oils in the diet, and eventually as body mass increases and we keep eating this way, we end up with a hyperglycemic state, a pre-diabetic state, and then a diabetic state, metabolic syndrome being the most common language used for hyperglycemia. It's associated with increased amounts of C-reactive protein and inflammatory protein. That is the best one to track overall body inflammation. Oxidized LDL is the problem. Regular LDL is not pathogenic. Then we have advanced glycation end products. These are going to be sugar-coated proteins and lipids. The most famous one that many of you listening may have had tested on a blood test when you came back from your doctor is called hemoglobin A1C. So hemoglobin becomes glycated. It's called glycated hemoglobin. There are others too. You can actually eat them as well in preformed, overcooked foods, as well as in animal products that are cooked to death. There's also fat that just collects by itself, but the lion's share of lipid is going to be found in these foam cells. Omega-6 fatty acids, they're involved. Free radicals are involved in atherosclerosis, and endotoxin is involved. Endotoxin comes from gram-negative bacteria in the gut, in the small intestine. It gets absorbed, and it creates flame all over the body, and it participates in the manifestation of atherosclerosis. None of this is mentioned in Game Changers or in What the Health. And then you have an immune profile shift where the immune profile becomes pro-inflammatory with pro-inflammatory macrophages and then pro-inflammatory T cells. This is associated with increased release of cytokines within the vessel wall, and cytokine upregulation overproduction is associated with the overproduction of enzymes called metalloproteinases, which digest connective tissue and allows for the expansion of the vessel wall into the lumen. So if this is all new news for you, then just rewind this tape and listen to it again. And it's all described very clearly in the book as well. So anyone who is out there as either patients or doctors should know this. Now, it's shocking to me that the medical doctors in What the Health and in the Game Changers didn't properly characterize the nature of atherosclerosis. They trivialized it to the point where you just eat some butter or a steak, and then all of a sudden you're going to have lipid buildup in a fashion that, of course, does not occur. So if you never heard the information that I just told you, it would be reasonable to be skeptical, although you can see it certainly is a much better story, and it's an accurate story compared to just the lipid deposition by itself without any other mechanism. Just eating it causes it to deposit, which is just, foolishness beyond belief. So how could you find out? Well, you can go to Boston University's medical school's website. So this is where it came from. I'll show you the URL in a second. Here's the URL. Easy to find this if you just put into your Google or whatever search window you use, search system you use, and put in pathogenesis of atherosclerosis, BUMC, for Boston University Medical College. And so very, very straightforward. Now, what do they show us? They show us what would you call this? This is just an image created by an artist, right? Versus what it really looks like. This is what a fatty streak looks like. So this is on the underside of the endothelial layer. So when people see this, they think somehow you ate butter or a steak and it just builds up. It doesn't work like that. What this is actually an image of is what I mentioned before, foam cells. Foam cells are the fatty streak. Well, how do we know this? Well, here you can see right here from the medical school, fatty streak are foam cells. You can see it right here, foam cells. Even smooth muscle cells that migrate into the intima, they take on oxidized LDL cholesterol too and participate in the creation of the atheroma. So initially the fatty streak is small, and it can be induced by stress, as you'll see in a little while. A lot of these pro-inflammatory changes can be created by chronic stress. Chronic stress is very pro-inflammatory in the absence of a metabolic syndrome state. So here's what happens. You have white blood cells called monocytes. They are attracted to the intimal layer, so endothelial cells, connective tissue, and down here is the internal elastic membrane. And so this is the intima, and all the big game takes place in the intima, and that's where the expansion occurs. So monocytes are attracted to and adhere to endothelial cells and then migrate in, and once inside the intima, they are induced by pro-inflammatory cytokines to become macrophages. And macrophages, they are known for gobbling up antigens, foreign particles. Well, LDL cholesterol normally is not pathogenic. It has to be oxidized, and then it is engulfed by macrophages, and they become they're called lipid-laden macrophages, and that's your fatty streak. You just don't eat butter and somehow it just layers itself on the wall or inside the wall. So this is very, very well known, this process. And so when you see the image in my book that I showed you before, you can see it is absolutely accurate, absent several factors, but they're not important in terms of understanding the pathogenic process. Like I didn't put migrating smooth muscle cells in there. So once again, we see that the initial part of it is going to be the fatty streak, and the fatty streak is built by the foam cells that have engulfed oxidized LDL cholesterol. How do we know it's oxidized? They should have showed it as oxidized right here. Well, you can see oxidation. This is from BU's page. Oxidation of LDL in the wall, and they say exposed to nitric oxide, which is anti and pro-inflammatory from different perspectives, but there are nitric oxide free radicals, and that can oxidize LDL. Macrophages can participate as well as enzymes. Now, they didn't talk about many other factors in there, like they should have talked about what I'll show you in a little while, the metabolic syndrome. The metabolic syndrome state, which is a hyperglycemic state, is the big inducer of oxidation of LDL. But what you need to focus on is that these monocytes, the white cells that enter the vessel wall, they convert into macrophages. They begin to take up oxidized LDL cholesterol, not regular normal LDL cholesterol. And we know that stress can do this. So this paper is a free download if you want to look at it, but chronic stress is highly pro-inflammatory, involves in cytokines and free radicals, and it can participate in the oxidation of LDL. And people who are otherwise would not be at risk, highly stressed individuals. I think I first read about it in papers years ago where these young 20-year-olds came back from Vietnam and they were so stressed out that they had fatty streaks for no particular reason other than being chronic stress. So you can forget about just eating butter and it'll cause all this. I mean, that's just so sophomoric and juvenile and embarrassing for anybody with even a biology degree. You should know that that is not true. So this is from a video I did back in 2016. And what you can see here, well, I'm just going to advance it a little bit. So you can watch this if you wish. And I also put this in my new book, and I added these factors because I spend more time looking at whether or not oxidized LDL would be involved in, I already included a low back pain, but you can see here bone loss, disc herniation, tendinosis, so tendon pathology, osteoarthritis, muscle weakness, low back pain, and indeed oxidized LDL participates in that. So how should we look at this? Well, you can see that the average American pigs out, we know that the average American pigs out on these foods. 60% of calories that the average American eats comes from refined sugar, flour, and then refined oils. When you see hyperglycemia, we're talking about a sustained state of hyperglycemia, so that would be the metabolic syndrome. And adding trans fats to the mix, what both do is they will take healthy LDL cholesterol and transform it into a small, dense LDL particle, which then becomes oxidized, free radicalized. So you have a free radicalized, inflamed LDL cholesterol particle. The same thing happens to HDL. HDL is healthy so long as it is not exposed to hyperglycemia of the metabolic syndrome, as well as trans fats. When that happens, now you oxidize and flame up HDL cholesterol. So it is the inflamed LDL that is engulfed by macrophages in the vessel wall, not healthy, regular LDL. Now, this is very simple, very basic, very well known, and those expensive fiction movies that try to demonize having a little bit of butter and meat, of course, left out because I can't explain why people leave out facts. I don't understand it. But what you should know, that we have total BS versus reality when we're looking at cardiovascular health. What the Health gave us a totally fake buildup of fat on the vessel wall layer. They showed a picture of it. I mean, it's just mind-bogglingly foolish. And then the Game Changers gave us this really weird lipid buildup that never occurs versus what we know actually occurs and very easy to understand. So with this in mind, you can see for sure that having a little bit of meat with some vino and vegetation is of no consequence at all. And so we know that James Cameron provided us with another fiction movie, and unfortunately they went full Tropic Thunder more than just a couple of times. I'm not sure if I'm going to do more videos, but you should see at this point that it's both What the Health and the Game Changers are so shallow, it's actually hard to imagine. And if you look online and see the press they're getting, it's unbelievable for just this made-up fiction story that apparently nobody is checking because people are just embracing it. Then maybe it's because of our movie culture. We believe what we see in the movies. But you should know that The Game Changers is another fiction movie by James Cameron.